Hey guys, Tony Maritato here, licensed physical therapist. And in today's video, I want to talk about icing, specifically icing your knee after a total knee replacement surgery. Now, some patients are going to be issued an ice machine. It's a recirculating machine that has a cooler. It pumps cold water through a sleeve that goes around the knee. That's amazing, but a lot of us don't have access to that. Insurance doesn't pay for it, or it's just more than we necessarily need. So on Amazon right now, these are my favorite gel packs. This is produced by a company called Chattanooga. It's the black, I don't know what it is, but it's the black ice pack. There's a light blue one also. Those are great. They're a little less expensive. I like the black ones because these things will never break. We've had a lot of the lighter blue ones that tend to split at the seams. But if it's just one person using it, we use this every day, 20 times a day. What I like to do is this is the cervical ice pack. I think this works really great for a knee. There are larger, oversized packs, rectangle packs, but after a knee replacement, once you've done your exercises, you're looking to just chill out, relax, reduce some pain, reduce some swelling. The cervical ice pack will fit perfectly over the knee. Now, if I wanted to, I could just sit back and relax. I'm sitting in a chair. There's a standard 19-inch chair. I put another chair in front of me. Usually at home, this would be like a dining room chair, a kitchen table chair. You could do it on the couch. But if you really want to increase the effectiveness of not just the cold therapy, but add a little compression to reduce some of that heat and swelling, I also like some of these knee wraps. Now, this one I think is from a company called Mava. But basically, it's a thick, stretchy strap. These are actually used when somebody's doing a heavy back squat. They want to wrap their knees to provide support. We're going to use this to provide a little compression and hold the ice pack in place. So if you're going to use this, you start at the lower part of the knee. You put the first wrap as what we call an anchor wrap. Then you're going to wrap up. You're going to tuck the ice pack under. You're going to have about 50% coverage, meaning every time I go over the last wrap, I want to cover about half the distance. And then I'll just go until I run out of strap. These usually have a little Velcro at the end. I can hold it in place. I sit back, I relax. Now I've got cold therapy. I've got compression. It's going to move some of that fluid out of the area. Typically, we would do this for about 10 minutes. If it's too intense, notice that I'm doing it over my pants. If it's too intense, you can put another layer of cloth. Sometimes we'll put the ice pack inside of a pillowcase, then put the pillowcase over your pants or another layer. It really depends on how your body responds to cold. Some people are very sensitive. Some people like it straight ice right on the skin. It is completely up to you at this point. A couple other little quick tips. The thing that I like about having a chair is if you've done this, you know that the leg has a tendency to want to roll out and it puts lateral stress on the knee instead of having the knee nice and straight working on extension. So if I use a chair like this, I could pull the chair in toward me so that my foot is actually up against the backrest of the front of the back of the chair. And then I can put my foot and my side of my leg against the armrest. So it actually functions to hold the foot nice and straight, which improves the alignment of the knee, which improves the alignment of the hip. If this is uncomfortable, you can angle the chair or angle yourself. Sometimes when there's a person with hip arthritis, if you have knee arthritis, you might have hip arthritis. Having the leg out to the side just a little bit is a lot more comfortable than having it straight in front of you. But the main objective is we want the toe up, we want the leg straight, we want the knee unsupported so that gravity is pulling us down into extension. And we have the cryotherapy, the cold therapy with the compression. Man, you layer all this stuff together, it feels amazing. It's going to help facilitate your recovery. It's going to support what you're already doing in physical therapy. Now, if you have specific questions, I'm hoping that you are working with a great physical therapist. Talk to that therapist. They're going to be happy to answer your questions. If you can't ask them, ask the surgeon. If you can't ask the surgeon or the therapist, drop a comment below or consider joining our free Facebook group, the Total Knee Replacement Support Group on Amazon. not on Amazon. On Facebook, we have over 20,000 members. It is an incredible community. It is free and available, but it is a private group. You do have to request to join. So guys, I hope this information is helpful. I'll catch you on the next video.